if families need that. And sometimes people just need someone to talk to that they're not going to hire, just to ask all the questions. So I'm available for that as well. I think that's it. I think the main thing for me about community birth is that it's really about having the time with your midwifery practice to find your path and learn about what your options are. And I think that that's the thing that we bring. One of the things that we bring is really time. I don't know who's next.
Yelena, would you like to go next?
Okay, hi. I'm Yelena Kaloji. I'm an RN and I'm actually a certified nurse midwife. You got me down as a CPM. And just wanted to note that. And what that means is I initially trained as a nurse in order to be able to get into nurse midwifery school. I've been in practice for almost 40 years. And at that time, the only choice I had was to become a certified nurse midwife. I have no regrets over it. I am strictly a home birth midwife, have been for forever. So I've got a lot of births under my belt. I know home birth, and that is where my focus. And my primary practice is Santa Clara County. I have gone up to San Mateo and I've done Santa Cruz. I'm honing in closer to home just because I've been at this a long time. So I'm doing fewer births and I'm pretty much booked through February, March at this point. One thing I'd really love to share with everybody, several things, my philosophy. You know, I see myself as an experienced midwife, and when somebody is looking for a midwife, I would hope that, you know, part of it is they're hiring me or you, some other midwife, for their experience, their expertise. But at the same time, what I think is really important is that I don't take over the experience. I want to make it a safe experience, a very positive experience, if you so choose to have a home birth. And I think along with that, what I feel was really important is how you choose where you're going to have your baby, to really hone in where are you going to feel safest. Maybe it may not be home, maybe it's not hospital, could be birth center, but to consider really where will you feel the safest and with whom. I always encourage, you know, meeting 2-3 midwives to get a feel for, we're all different, we all have different personalities, different experiences. And then finally, I'd like to promote my docu-series. I don't know how many of you are aware that I did a 12-episode docu-series on the wisdom of a home birth, the wisdom of a midwife. And it is not just about home birth, it's about midwifery care and doula care, but primarily midwives. And you can find it on YouTube, linked to my name, Yelena Kaloji. That is my official name. And it's on my website, To Birth. The whole series is on there too. And each episode is about 15 minutes on average, but it'll give you a real feel for what we as midwives do, and doulas, and the difference between us. Anyway, thank you, and I'll look forward to questions.
Thanks, Yelena. Byron, would you like to go next?
Hi, I'm Fyron Jones. I'm a licensed midwife and a CPM, and I own Nightingale Birth Center. We are located in San Mateo. We are the only freestanding birth center currently on the peninsula. We are one of a handful of freestanding birth centers in the Bay Area. There's one in San Francisco, there's a couple in San Jose, Morgan Hill, there's also a couple in the East Bay. But we're the only one in that area. A freestanding birth center is very different than what a hospital calls a birthing center that's located in a hospital. A freestanding birth center, freestanding means that it is not connected to a hospital and it's not necessarily associated with a hospital. What that means is that we have a lot more flexibility. We don't have to adhere to certain hospital policies like their induction protocols or IV protocols. So you have a lot more flexibility in the way that we do birth at a freestanding birth center. And it's also a very home-like facility. If you looked at our website, you can see that the birth rooms, we have 2 of them, look very much like a bedroom. They have a big bed. Both of them have big birthing pools. We offer water birth. And we do offer nitrous oxide at the birth center, which is one of the things that differentiates birth center from home birth. If you watched Morgan West's video that Allison mentioned at the beginning of this, she talks about the difference between home birth and birth center. And in terms of safety, there's really not that much of a difference. It's often the same midwives that do home birth and birth center. In fact, Nightingale Birth Center, we do serve some home birth clients as well. It's the same medications and equipment that we bring to a home birth. But one of the things that I will say people like about the birth center is we have the nitrous oxide, which is it's a pain relief medication, not like an epidural, but it does kind of help take the edge off. So a birth center also is very personalized care. We only take somewhere between 5 and 10 clients due in any given month, which means we have a lot of time to spend with our clients. We know you, you know us by the time you go into labor and you know who your team is. One difference between often home birth and birth center is, at least our birth center, is that we have a team of midwives. Currently we have 4 midwives. We have 3 licensed midwives and 1 certified nurse midwife, and we all care for you as a group. So between the 4 of us, we have a little over 3,000 births under our belt. So we've seen a lot of things and really focus on safety and evidence-based care at the birth center. I think that's it for now. It's great to be here, and I look forward to answering questions.
Great, thanks, Byron. Jasmine, would you like to go next? Oh, Jasmine, it seems like your microphone might not be working. Maybe we can have Amanda and then we'll circle back around to you. Does that sound okay? I'm sorry. Okay. Amanda, welcome.
Thank you. Hello, everyone. My name is Amanda Verzello, and I delivered at home last year with Maeve Sundstrom, who practices on the peninsula. And I have previously delivered at a hospital. I delivered at the Redwood City Kaiser facility with their team of midwives, and I delivered there in 2017. And the reason I chose to do a home birth for my second birth is a few reasons. First, I wanted to be able to control the setting of my birth. So there were a few things that happened during my hospital experience that were kind of a turnoff to me. One is they wouldn't let me film the birth of my baby, which was very disappointing in the moment. And I resolved that I would have the opportunity to film the birth of any subsequent child of mine. I also wanted to be in an environment where I could control the pace of the birth. So for instance, I had a doula with me, and I felt like we had a really good rhythm going throughout the labor process. But then when it was time to push, when I was complete, I felt like they sent in the cavalry. The mood of the room totally changed. They brought in all this equipment, lights went on. It was like a total change of setting, and it just kind of threw off my rhythm. And it went from my doula and me just laboring at my pace to a team of people kind of telling me exactly how to deliver my baby and how to push and, no, don't do this, but do this. And it didn't really feel natural to me. And I wanted to be in a setting and with a birth assistant who would honor the way that I wanted to deliver my baby and the pace that I wanted to go at. I felt like my body's natural pace wasn't really honored. So I knew that in a home birth, it would be more up to me, how that pushing and delivery process would go. And then there's a third factor that I didn't even realize until after the fact, that is now important to me for choosing midwifery care, and that is how much I appreciate the intimacy of the care. To me, it's like a journey of building a relationship with my care provider that continues through the day of delivery and beyond. I have a close relationship with my midwife now that I cherish so much, and I see her as a confidant and a support who I can turn to at any time, because we had so much time to bond during our long prenatal sessions, and of course during the birth itself. So those are my top reasons for choosing a home birth. And as far as how the process of care went, I had at least around 1 hour long meetings with my midwife for basically all of our prenatal sessions. We just talk about all kinds of things. We talk about, my health, how things are going at home, what my, overall like psychology was like, just, my emotions, everything. And we always talked about how I wanted the birth to go, what was my vision, what I did not like from my last birth, what I wanted to change for this birth, so that by the end of our visits, when I was ready to deliver my baby, I felt like my midwife really knew me, what I wanted, and how I wanted to have this baby. And as far as the ultrasounds, because I'm sure some are wondering how that works, I actually went to an offsite facility for my ultrasounds, and I was able to do the normal 20-week scan, and then I had a scan, I think, like around 35 weeks to check the baby's position, and those worked out just fine. Everything else my midwife was able to take care of. And then for the birth, I texted my midwife when I started feeling contractions, and then we just stayed in touch that whole day. She just told me to let her know when I felt like she should come over, and I was able to actually labor by myself for most of the day and even through the night. And then I told her, at a certain point, that I thought it might be good for her to come check me. And then my baby was born 2 hours later. So it was a very smooth process. And after the baby was born, my midwife stayed with me for a couple hours at my house to make sure the baby was okay, make sure I was okay. And actually, I had a little bit of a unique circumstance, because I actually transferred to a hospital a couple hours after my baby was born, because I had a pretty intense perineal tear that my midwife said that normally she can repair like tears that are normal, but my baby was almost 11 pounds. And so I had quite a serious tear that she felt would be better repaired by an OB. And I'm glad that she made that call, because we transferred to the hospital. They were able to repair the tear very well. And then I was back home just a few hours later. So that wasn't, didn't have a big impact on the experience. And after I had the baby, my midwife came back and checked on me the next day. And I think she came a few days later, and we continued to stay in touch. And she came for regular visits to make sure me and my baby were okay. And something to note is I had a little boy, and one thing that's different about having your baby at home versus at the hospital is if you would like a circumcision, that needs to be done with a urologist, that you get a referral from your pediatrician. So that was a little different, because at the hospital they did that, while I was there. And my midwife also went to the county recorder's office with me to help me get a birth certificate. So there are a few more kind of manual aspects of the home birth process, but of course it was all worth it for the experience that I got. And ever since my birth, my midwife and I have just generally stayed in touch. We're friends. I continue to update her about my life, and I really see her as a source of wisdom. And I just look forward to having a relationship with her for a long time. And general thoughts on having a home birth, I would say if you're here in this session, if you're curious at all, that means that you have that fire inside of you and you should go for it, because it is such a magical experience. It's the most empowering thing that I've ever done, is to have my baby without any medical intervention. And even though I had my baby at the hospital without any drugs, the difference between the hospital experience and my home birth experience is really night and day, because I had so much more control over my environment, over the people who were there. I was able to have, basically anyone I wanted or didn't want in my home. And my midwife even just had her hands off, and I was able to almost completely deliver my own baby myself, which was a very intimate experience for me and my baby. So I am really excited for all of you just to be here and to be learning about this really, really magical experience that you could have with your baby.
Oh, that's so beautiful. Thank you so much, Amanda, for sharing your story and your experience. And thank you so much for being here. We really appreciate it. Jasmine, if your mic is working.
Can you hear me?
Yes.
Awesome. Okay. So I am Jasmine Murata Janicki, and I am a licensed midwife and certified professional midwife in San Mateo, and I practice in San Mateo County as well. Sometimes I'll go to Santa Clara County or San Francisco County, but I'm trying to stay on the peninsula. So, yeah, San Mateo County. I originally was trained in a midwifery school in Portland, Oregon, and then I worked in Portland, Oregon for a couple years before moving to Washington. And I worked for a few years in a very rural private practice. It was just me, and I was the only midwife for, almost 3 hours away. So I had a practice in rural Washington for a couple of years, and then I moved back home to San Mateo, just because my whole family is here. So it's really nice to be back. I have been working very closely with Maeve Sundstrom of Redwood Midwifery, and we've been, sharing clients together and working as a team, which is really wonderful. It's very nice to be able to know that there's another midwife who our clients know. We both, typically every home birth, 2 midwives attend every home birth, and usually there's an assist and a primary midwife. And right now we sort of have 2 primary midwives for every client, which has been really nice. It also allows us to take care of ourselves a little bit more than I think we otherwise would be able to, and have some time off here and there, which is, I think, incredibly important for midwives, and just to be able to really come with all of us, with all of ourselves at our best, I think. I believe that midwifery care really is all about individualized care and informed choice. And I think that both Maeve and I really focus on that a lot. I think most midwives focus on that a lot, which is a really wonderful thing. I think that it's a very unique experience for people. And yeah, and I look forward to answering questions. I think that's about it. Bye-bye.
Thanks, Jasmine. So I know that Amanda so eloquently put from her own experience about what her midwife care looked like prenatally, birth, and postpartum. But I'd love to hear from the midwives, kind of breaking down what midwifery care looks like in the prenatal period, during birth, and postpartum. So maybe we can kind of split it up. Maybe Teresa can talk prenatal, maybe Yelena and Fyron can talk birth and Jasmine can talk postpartum.
How about if I do postpartum?
Sounds good.
I can do it with Jazz if she wants to, but I want to talk about
Okay. Does anybody want to take prenatal? Okay, go for it, Fyron.
So at the birth center, and I think this is probably true for most home birth midwives, although anybody who does a different schedule, pop in and let them know. We follow basically the same schedule that an OB does. So we see our clients about every 4 weeks for the first 2 trimesters of pregnancy. That's to about 28 weeks. We usually start care somewhere between 8 and 12 weeks of pregnancy. The very first visit is often a longer visit. It's usually somewhere between 1.5 hours to 2 hours because we do a medical history intake. We often will draw labs. If you haven't already seen a provider and this is your very first visit, we kind of orient you to how things work, how to get in touch with us in case you need us. All home birth midwives and freestanding birth centers have 24-hour phone service. So you have access to a midwife. Anything comes up anytime during your pregnancy, birth, or postpartum, you have access to your midwife. That's true for home birth and birth centers. So that first visit is a little bit longer. And then we see you every 4 weeks, about hour-long visits generally. During the visits, we do the same things that the OB does. So we listen to the baby with the Doppler, so we listen to the heart, we measure the belly, we feel with our hands baby's position. And that's something that's a little bit different that midwives do. We don't just rely on an ultrasound machine. We really use our hands to determine baby's position, and we're really good at it. We do any labs that need to be done. We will often weigh you. Some midwives will do a urine dip. We do blood pressure and pulse. So those are pretty typical. But then that takes about 15 minutes. So we have about 45 minutes to just kind of chat, like Amanda was talking about. How are you feeling? What's going on for you? How are you preparing for your birth? How can we support you with aches and pains of pregnancy and stuff like that? And just kind of getting to know each other. I mean, before COVID times, we would offer you a cup of tea at the birth center, and it was a very casual, just friend-to-friend chat in a lot of ways. Once you get to 28 weeks, which is the beginning of your 3rd trimester, we start seeing you more regularly. We see you every 2 weeks. And then once you get to 36 weeks, which is about 4 weeks before your due date, we'll start seeing you every week. So usually if you start care earlier in your pregnancy, we've seen you somewhere between 10 and 15 times often. So we have a lot of interaction, a lot of time to get to know each other. We know your dog's name. We know your other kids' names. We know each other by the time you call us in labor. And I'll pass it off to our labor team.
Yeah, Yelena, and maybe Jasmine, the 2 of you could chat about labor.
Yeah, I just got to, okay, I'm unmuted. Yes, I'd love to share. I mean, I think those are really important issues. Just the time frame is very similar to the OB practice. What I think is really important is we really spend time with you, the client. And until COVID, it included the whole family and friends sometimes and grandparents. You know, I have a room full of toys for little people. And unfortunately, those days are on hold for now. But what's really important to me, and I think most of us, is that we don't cookbook. You come to us, you're an individual, you're unique. We work with you on a very unique level. And by time your baby is coming, we have built a huge layer of trust in each other. We know, we have a pretty good sense as midwives, how you're going to do, what your needs are. And I think the biggest thing of all is that we really have time for each other. I've heard several clients who had previous births with particularly Kaiser, and we're told we don't have time for your questions. And I just can't imagine telling a client, like any of us could, and we call you clients, not patients, because you're not a patient, you're healthy, that we wouldn't have time for your questions, either during the prenatal or if you think about something later. You call us, you text us, you email us, but we're there for you 24/7. And I think that's so important. And Jasmine, do you want to contribute some too?
Sure. In terms of prenatal care, one other thing is that we do talk about any testing or options that come up. For example, gestational diabetes test or GBS testing. We really talk to our clients about what that's for and the pros and cons and the risks and benefits of the testing. And then, it's up to you, our clients, to decide whether or not that's right for you, depending on your family and your values and your belief system. And so we don't, and this is throughout your entire care. So prenatal appointments, during the labor and birth itself, and postpartum appointments, we are not going to push anything on you. We really try to give you all of the information that you guys need to make the decisions that are right for you. And then you're the ones making those decisions. And I think that's a really important piece of information to have. So
We call it shared responsibility. I think that's
yes.
really important. We are in it together.
Yeah. In terms of labor and birth, typically when, our clients will call us when contractions start happening, and usually beforehand we talk about when to call your midwives and how to call your midwives. And once you're in labor, you give us a call, and when you're in active labor, we come to your home. We initially will take vitals on you and probably ask you a bunch of questions, such as when you ate last and what, when your last bowel movement was, for instance. We get very personal. And then we meet you where you are. So if you're, really needing to concentrate on your contractions, we'll probably stay pretty quiet and we'll listen to baby, make sure that everything sounds okay with your baby, and then we'll allow you to labor at your own pace and come in and check on baby every 20 to 30 minutes in active labor, and more often as you get closer to pushing. And so when I say that we meet you where you are, if it seems like you're really wanting more support, we will stay by your side if needed. It seems like you and whoever you are laboring with, whether that's a doula or your partner or another friend or family member, if it seems like you guys are doing really well on your own, then we'll probably give you guys a little bit of privacy and check on you often enough to make sure that you and your baby are all healthy. I know I personally encourage my clients to labor in whatever positions they feel most comfortable in whatever room they feel most comfortable in. I encourage clients to eat and drink as much as they would like. I really encourage drinking, even if you're not if you're not very thirsty, it's important to stay hydrated. And we kind of, follow you and meet you where you are. So yeah, do you want to cut in about labor at all, Elena?
Oh, sure. I thought Teresa was. Oh, Teresa, you want a postpartum? That's right.
Postpartum. Yeah.
Yeah, labor. We're trying to be visible and invisible at the same time. There, we move in as needed, move out, away. It's just being patient and waiting and allowing things to take its natural course. And we love to use water. Is a very therapeutic. Most of us, I think, have birthing tubs, and sometimes showers are even better. It just really depends. And we have all kinds of tricks and tools for, if you've got a stubborn baby, there are a lot of things we can do. We carry, herbal medicine, herbal tinctures, homeopathic things. We have a variety of things that we can use that are non-medicine, so to speak, to help guide you through your labor. And we are patient. And let's see, where else? Anybody else want to add anything labor-wise? I'm just trying to.
Sure.
Yeah, to piggyback. Oh, sorry. Go ahead.
No, you first, Byron.
I wanted to piggyback on what Yelena was saying about herbs and homeopathics, and absolutely. Sometimes I have potential clients ask, well, you know, can you give me a medication or can you give me an IV? And the truth is that we do have those, and oftentimes we also have the medical thing, the IV. A lot of us carry antibiotics that we can give if you're GBS positive. We can refer for the ultrasound. We can do the standard medical test. Just because we offer alternatives doesn't mean that we don't have the standard medical stuff as well, usually.
I was going to also add, in terms of labor and birth, I think that how hands-on or hands-off a midwife is really can vary a lot. But I know that many midwives, I think, try their best to allow birth to unfold as naturally as possible and interfere as little as possible in the birth process, except to ensure your safety and your baby's safety. So if hands-on is required to make sure that birth is normal, then we will be very hands-on. But I think that we all work very hard to make sure that birth can proceed naturally in a healthy way. And usually that involves being fairly hands-off. So, yeah.
And I think at the same time, we are generally very respectful, hands-off. But if a true emergency happens, which is pretty rare, I mean, say, we really felt like Pitocin was needed because you're bleeding more than should be, that we may not have time to discuss it. We're just going to go ahead and do it. And those are rare occasions, but it's just, we're there to try to make it as smooth and free of problems, and by being able to allow things to flow and give women time. I mean, there have been times in births where mom has gotten to complete but not ready to push her baby out, and we just hang and wait. Maybe she needs a nap or something to eat, or just needs to process, oh my God, I'm going to be a mom, am I ready? So we're just, I think what I've learned is, my first career was going to be in psychology, and I realized I never went that route at all, but really that's where I'm at, because so much of midwifery care is truly about connecting to you and just the psychology, your emotions, what your fears are, to really dig in, to get to know you and help you draw out any fears or things you may not even think you have, that can help you towards a better birth.
I would say one of the things you said earlier, Yelena, is that we have time, and I talked about that too, and that you build trust in that time. And one of the things that makes birth outside the hospital safe is the trust that exists on both sides. And in that moment of needing to make a decision, if something comes up, you've had an opportunity to discuss it before you ever get to that place, so that if we have to make a suggestion to you about, like, we need you to change your position, the reason that we're asking you to do that is because we really mean it, that there's something that you need to respond to. And because we've built a relationship built on trust, then we have the opportunity to not have all it be verbal conversation. We don't have to have a long chat about every single thing in labor, which gets us out of your face in labor and lets you have your labor. At the hospital, one of the things that happens, and I love hospitals for what they're good for, but one of the things that happens is, hi, Elena, my name's Sally. I'm your nurse. I understand you want to have a natural birth. how are you doing? What are you know, and we don't have to do that because we know you. We don't have to do that every 8 hours. We can just come in, put our hand on your leg and say, I know this is a big thing happening to you. This is a really big thing. And that is great. And then you get a baby. Wow. So if it's okay, I'll start talking a little bit about postpartum. Because
yeah, go for it, Teresa, because we have a couple questions from the
I'll make
audience.
it quick. I'm going to talk about two parts of postpartum. One is immediate postpartum. And Yelena said one sentence about it that made me think about it. So that initial, the baby comes out, you're in postpartum, you're have your baby. And so there are two midwives there generally, or a midwife and an assistant. And that's because there are two people to care for, the person who's given birth and the baby. And so we're watching closely because this is a very dynamic time. We're making sure that the baby is transitioning well, called extrauterine life. It's come out and it's trying to figure out how to breathe, and we leave the cord intact so that they're getting oxygenated blood from the placenta. We don't rush anything. We just wait for the placenta to come most of the time. Most of the time it comes within the first half hour. We watch you have your baby, you know, on your abdomen and then on your chest, and the second midwife watches the baby. If the baby needs assistance, we are trained to provide that assistance. In this dynamic period of time, we're also watching for the placenta and we're watching for bleeding, because that's one of the most common things that can come up. It doesn't come up very often, but if it does, it's the thing we need to pay attention to. And that's where we might use herbs. We might have you stand up and squat to birth your placenta if you're bleeding a little bit more, or we might use some medication, depending on what's going on. So the midwife's job, big clinical picture. She's keeping an overview of everything that's happening in that room. How's your partner doing? How's the baby doing? How's your bleeding? What's happening? That's the big picture. That takes between 2 and 4 hours of time, that clinical picture. And in that time, we help you get cleaned up, we help you breastfeed, we help you bond, as if bonding is a thing that happens once. It doesn't, it happens your whole life. I have a 37-year-old, I'm telling you, we're still bonding. Then the best part, sometimes for some families, the best part of midwifery care is the weeks after the baby is born. Because we continue to be involved with you. We see you the next day. We make sure that breastfeeding is going well. If you need resources beyond our capabilities, we refer you to an appropriate medical professional or breastfeeding support, therapist, like whatever you need. We're there to try and help you have as smooth a transition as possible. And sometimes that means I get a text that says, are these spots supposed to be that color? My baby's poop looks funny. And we're there to, support you. Now we do ask, if you have poop questions, can you do it between 9 and 5? Okay, maybe a 3 in the morning poop question can wait till morning. But we're there and we're trying to help you have the most wonderful transition to parenting. And when it's rocky, we're there more. And that's really, we're there more when it's rocky.
Thanks, Teresa. And thank you, midwives, for sharing all of that wonderful info about the process.
One more thing, Allison. I just wanted to follow up with the postpartum, because I feel like no matter how long labor is, postpartum is a really, really critical part. Those first few weeks, especially for first-time parents, when they're just learning about breastfeeding, learning about being parents, all that, they need so much. And, unfortunately with the hospital experience, there's so little follow-up. And then by the time they follow up, the breastfeeding issue is done, whatever. And I just feel like postpartum is everything. And I think those first 4 to 6 weeks are critical. Just wanted to add that.
Thanks. So we have a question from one of our attendees, and I'm actually gonna unmute her so she can ask it in her own voice. So yeah, there you go.
Hi, my name's Liz. Can you hear me?
Yeah.
So I'm 29 weeks. I'm really wondering like, when do I really need to decide? And because I know it's late in the game, but I had a successful home birth with my first child. I loved almost everything about the experience, except having some postpartum complications that sent me to the emergency room a few days after birth and then a few more days later. And that piece of it was unsettling and left me with this feeling of I'm not having the integrated care experience that I really wanted to have with a midwife. And so, when I got pregnant the second time, I thought, okay, I should go, do the hospital thing this time so that I'll have the OBGYN as the sort of continuity of care piece. But with COVID, as well as just many of my original hesitations about a hospital birth still exist. I've just been on the fence my entire pregnancy. And so, like, when do I really have to decide? Like, when do I have to pull the trigger and say, like, I'm gonna do this hospital birth or I'm gonna do home birth?
Now. 49 weeks, you got to make a decision. I mean, people take people later, but you really want to be in care with someone soon.
Yes, the sooner the better, because it's establishing a relationship where we can build a relationship of trust on both ends. So, I mean, I've taken somebody a week before they had their baby, but that is not optimum. And the other thing, as I'm sad and sorry to hear, it sounds like you didn't get the postpartum care you should have had needed from your midwife. Is that what I'm hearing? Is that she wasn't there? Or I'm just trying to wonder what happened with postpartum.
So everything that you guys were saying about the integrated postpartum care, like in terms of getting breastfeeding going and the care in home for me and my baby in those days following the birth, like all of that was wonderful. I ended up developing postpartum preeclampsia. And so that was just beyond her scope of being able to support me. And her tool that she had to support me was the emergency room, which was not a helpful place to seek the care that I needed.
One thing is, when you interview midwives, is to talk to them about your experience, that you had this development, and talk about whether they, how they could help you create a plan for that specifically, both for prenatal, preeclampsia, and postpartum, because there's risk there. And so I think it's a lot about creating plans. And I think this is true for every family, that this is part of what we do. So as licensed midwives, I know Yelena does this too. We have a plan in place for emergencies, and whether they be acute, like we need to do something right now, emergencies, or farther out. And then, so being clear about what the plan is, I think can be really, really helpful.
And I want to add, it sounds like you still have some PTSD regarding your birth. And I think it would be really good to settle on a care provider as soon as possible, but also to find a therapist if you haven't, to discuss, to work through the issues that are still unsettled for you, which might help you feel more secure in the decision that's right for you, whether you do another home birth or go to the hospital. And there is, I don't know if you know, Jessica Scorsese her specialty is pregnancy and postpartum. So she might be a good resource for you if you're in San Jose area.
Is that a therapist, Yelena?
Yes. Jessica Scorsese is a family marriage therapist, but her specialty is really pregnancy and birth, postpartum, PTSD, that sort of thing. So I think that might be she might benefit from that too.
Great. Thank you so much, midwives. And thank you so much, Liz, for for your question. We have another question. Can you explain how you are facilitating care in this time with COVID-19? Is all interaction virtual until the birth?
Well, for me, I'm doing the initial appointment has to be in my office. And then, you know, early, if there aren't any issues, then yes, it's virtual, depending on what's going on. And then towards the end of the pregnancy, we'll be back to the office. Unfortunately, not having daddy's family members other than mama in the clinic, that's really the hardest part, because don't get to, but I have kind of a unique office. I have my home office. So I have a patio area outside my office. So I'm able to meet the daddy and the kiddos or auntie or whoever. We can hang out outside, and then I have a park down the street I have them go off to while I take care of mom indoors. But you know, the COVID definitely complicates how we can interact, and we as midwives, we're touchy-feely people, you know, so it's really, it's not easy, but we really do our best. I don't know about Firen and Teresa, how you're doing it.
And Jasmine too, if you wanted to chime in too.
Sorry. Yeah.
So my schedule is a little bit different. We are doing part of our appointments virtually and some appointments in person. Right now, our schedule has been pretty much every other appointment is in person, and every other appointment is Zoom. We are willing to change that if, you know, if people are preferring more Zoom appointments, we can do more of them over Zoom. And if people are needing a little bit more, you know, if something's going on and you need more in-person appointments, then we can always do that too. Right now, I don't have an office. I am doing only home visits. And so all prenatal appointments as well as the postpartum appointments are in my client's home. I am wearing a mask at every appointment, and I'm asking my clients to wear masks. Anyone who's at the appointment to also wear a mask during the appointment. I'm not asking laboring moms to wear a mask at this time, but I will be wearing a mask at every in-person, you know, interaction that we have. I'm also asking any other members of your family or support people who are at your labor to wear a mask. I've also changed in terms of how I'm dealing with COVID. I've changed some protocols as well as some of my prenatal bag is very different now. I have a plastic toolbox that I wipe down in between every appointment, and I usually clean all of my instruments while I'm still in your home after we use them, as well as before appointments. So it's a lot of cleaning. Yeah, those are a few things I'm doing. So
I can speak to what we're doing at the birth center currently. We've, as you can imagine, gone through different iterations as we get more information about how COVID is spread. So currently what we know is that wearing masks really, really helps reduce the spread of COVID. So we have welcomed partners back to clinical visits. We had for a while just decided only clients could come to clinical visits, but now we are inviting the partner to come to clinical visits. Like Jasmine said, we're doing roughly alternating a Zoom visit with an in-person visit. And yet, like Yelena said, the very first visit is always going to be in person because of the physical part of the assessment. And our birth center actually is really well suited for airflow. We got really lucky in that way. We have a sliding glass door in every single room. So we're actually keeping a lot of the doors open with fans. So we have a lot of really good airflow. All the midwives wear masks. We do a screening at the door before you come into the birth center. We take your temperature and ask you screening questions. and of course ask the partner and the client to wear a mask at the visits. At the birth, we are usually open to having anybody you want at your birth, your kids, your family members, your friends, your partner, of course, your doula, your photographer, whoever. Right now, we are limiting it to 2 people, which usually is the partner and a doula or a family member, other kind of support person. So 2 people at the birth, in addition to the laboring person, and we are not currently asking the laboring person to wear a mask because we just feel like, man, giving birth is so much work on its own, and asking you to wear a mask just feels really cruel. So we're just trying to keep the airflow going. I think that's about it for our protocols around COVID right now. But I did want to kind of circle back just super briefly to Liz's question. I noticed that Maura had mentioned concurrent care, which is something that wasn't brought up. You can sometimes find a midwife and an OB who may not be able to work completely side by side, but you can see both of them. And so have kind of that fallback OB care who you can call. So it's not necessarily an ER visit that can kind of ease that transition and smooth that transition if you need that extra level of care, Liz. I know Dr. Ridfers in Redwood City has done something like that in the past, in the not too distant past. I don't know where you are, but that's something that you might look into.
I did with Byron. I did a lot of postpartum visits at the very early days of COVID, virtually, which was the first time I did. I got so good, I was diagnosing tongue ties virtually. And I did a lot of breastfeeding support with, okay, just put that pillow a little under your elbow. And even though it was very awkward and very different, and can somebody hold the computer up, I actually felt like I gave really good care to people, very intimate care and very supportive care, and also caught things that needed more additional care when then we saw someone in person. So there was this layered look to it. So I think that even having virtual visits can be still provide some of that emotional support through pregnancy and postpartum. It's different. It's not the same as sitting with a cup of tea, but there's still a scope for that. We are having to have bigger imaginations a little bit.
Yeah, thanks, Teresa. I want to add to that too. We are asking our clients to get a hold of a blood pressure cuff, a thermometer, a weight scale if we're doing their weight. If clients are sensitive about weight, we don't take it, but most of them aren't, so we do that. And an infant scale for postpartum visits, because we do some of our postpartum visits virtually, and weighing the baby is really the most important way that we can know that the baby's getting fed. A lot of new parents worry, is the baby getting enough, especially if you're breastfeeding, you can't really see the transfer of the milk. But if baby's gaining weight, you're good to go. And that's just a gold standard. So getting an infant scale, you can get all these things on Amazon, and it's really great for you to have that information. I think in the time we've been doing the Zoom for about 4 months now, it's kind of its own special thing. You can actually do a lot through Zoom, and I never would have thought so, but it is, I don't necessarily know how if it feels quite as whole for our clients, but it's not as far away from whole care as you might think. So.
Great, thank you so much. I just want to keep an eye on the time. We actually have gone past 9 o'clock, so thank you so much, midwives, for being here. We appreciate it so much. And thank you, Amanda, for sharing your beautiful story and your experience too. Thank you, attendees, and thank you everybody on Facebook Live who has been watching. I hope you have a fabulous evening. And if you would like more information, please, if you're on Facebook Live, just let me know, and or you can email Allison at blossombirthandfamily.org, and I could send you the slides from this presentation as well as any follow-up resources. So thank you, everybody, and I'm gonna close it out. So have a fabulous night, and we'll see you next time.
Thank you.
Thanks
Thanks.
for having us.
Thanks.
Thanks. Bye.
Bye.
Nice to meet you, Gina.
Yes, nice meeting everybody and seeing you.
Yeah.
Good to see you, Jasmine.
Yeah.
Nice to meet you,
Meeting
Mila,
good.
Melina.
Well, bye-bye. Bye.
Bye. Take care.